Okay, ma'am, let's begin. I have started the recording and I'll introduce you and then I'll hand over the platform to you. Is it okay?
Sure.
Yeah. So, hi everyone, welcome to Upstart Live by payU. payU, as you all know, is one of the largest payment service providers in India. Upstart sessions are our way of connecting subject matter experts with the founders and entrepreneurs. We talk about various topics which are required to successfully run a business. I'm Palak in the marketing team, and our session today how to prevent third COVID wave session with Dr. Monica Bhagat, Medical Director of Bhagat Medicare Center and Nursing Home in Delhi. She's been actively involved in Step 1 program with the government for the online treatment of COVID patients under home isolation and also gives training for COVID triaging to doctors and volunteers of different states all over India via Step 1 organization and crime. She's going to share her thoughts and experiences as a medical professional who's been in the front line since the COVID first wave. So, uh, over to you, doctor, and thank you for being here with us today. I hope everybody can hear us, and if you have any questions, just drop it in the chat box, and we'll be able to answer them in the end.
So am I audible?
Yes, ma'am, you are.
Namaste, good afternoon, hello. I'm Dr. Monica Bhagat, COVID expert and Director, Bhagat Medicare Center and Nursing Home. This is my message to India and also the entire world. How to control the third wave of COVID and other future waves of COVID-19. Thank you, payU, for giving me this opportunity. Firstly, can you all see this PPT? Hello, can everyone see the presentation?
Yeah, we can.
Okay, that's great. Firstly, I would like to salute all the COVID warriors who have laid down their lives.
Can the others please mute themselves? Can the others please mute themselves?
Can you hear me? Am I audible?
Yes, ma'am, we can hear you, but this is for the other guests. Please mute yourselves. We can hear you here. We would like you all to mute yourselves. Unless you're the speaker, please mute yourselves.
Firstly, can you hear me? Am I audible?
Yes, ma'am, we can hear you. We can hear you. Please continue.
So I would like to salute all the COVID warriors who have laid down their lives while doing their duty for humanity. 730 doctors lost their lives in the COVID-19 in India. Dear friends, we are most probably dealing with an engineered virus and facing this kind of situation for the first time in the history of mankind. Previous pandemics like Spanish flu and plague were due to natural organisms. I would like to show you a few glimpses of the second wave in India. The lethal Delta variant emerged, and we are still reeling from this tsunami which raged for 108 days and devastated many areas of India, where many people lost lives and others developed permanent or long-term disabilities. Reason for this was that after the first wave, we became complacent and let down our guards. And look what happened. We didn't even realize what had struck us. There were 20.6 lakh cases in the first half of April, 276 cases per million of the population. Cases in India increased by 700%. And they increased by 700% in a span of just 108 days. 4 lakh cases daily, contributing to 47% of new cases globally. In the graph, we can see that between March 2020 and February 2021, India was able to cope reasonably well as the first wave was not that aggressive. But suddenly, due to the Delta variant, in a very short span from March to June, there was an unprecedented rise of cases which sent the entire country reeling with literal collapse of the healthcare system in many parts of the country. As shown in the second graph, as the number of cases increased, so did the deaths, and they came to about 4,000 per day. Dear friends, let's talk about the third wave. You all must be thinking, what is the third wave? Will the third wave actually come? If there will be a third wave, when will it come? Will the third wave be more lethal? Will the third wave affect mainly children? Well, these are the questions which I'm going to answer one by one now. What is the third wave? This refers to a possible surge in cases at the national level. The curve has reached a declining phase after having peaked on May 6. Since then, cases have significantly dropped. If there is a fresh surge by the end of July and it continues for a few weeks to months, it will be known as the third wave. Will the third wave actually come? Well, health authorities have been warning us about the possibility. If we see these graphs, we can make out that US had 3 waves, where each wave was bigger and the third wave was devastating. India has had 2 waves, but look at Delhi, which has had 4 waves, and the 4th wave coincided with the 2nd wave of India at the national level. Now, Madhya Pradesh's 3rd wave coincided with India's 2nd wave. So this kind of pattern tells us that the 3rd wave will surely come. When will the 3rd wave come? As per model analysis, 3rd wave will start in the first week of August 2021 and will end during October 2021. According to some experts, it's just 4 weeks before the 3rd wave starts around end July. 3rd wave will depend to a large extent on mutating variants of the virus. The variants of concern are alpha, beta, gamma, and delta in different parts of the world. The new Delta Plus strain is a variant of concern now for India and may be the cause of the 3rd wave. Factors impacting the 3rd wave. New and emerging strains, their transmissibility, immune escape. If strain of virus is such that it escapes our immune system and infects humans, even if they are vaccinated, it can cause a major catastrophe. Virulence of the virus. How deadly will be the new mutant strains? Seroprevalence has limited value, as even though many people are immune to the previous strains due to infection or vaccination, they may not be immune to the new mutant strains. Vaccine coverage also will play a very important role in impacting the 3rd wave. People who are partially vaccinated, that is, they have received just 1 dose, they may not be very immune to the virus. And if the vaccines are able to protect us from the newer strains, the third and future waves may not come so easily. Coverage of high-risk population will be a great help to us. Now another question. Will the third wave be more lethal? Many are predicting that it will. However, I feel that the third wave will be controlled by preventive measures, preventive arrangements. If so, then the peaks will not occur. Will the third wave affect mainly children? The answer is a big no. Look at our first wave and second wave learnings. The table shows the age demographic and death rate in the two waves. As we can see, the percentage of people affected in different age groups is almost similar in both the waves, and so is the death rate. Most probably, the third wave will follow a similar pattern. Both waves till now saw virus affecting all age groups, and mortality was high in the old age, 22%, and least among children. This slide shows the average weekly hospitalizations between peaks and troughs per age group of the CDC surveillance data of COVID-19 at the US. The slide clearly shows that children had least hospitalizations as compared to adults. And as the age of adults increased, along with their comorbidities, so did the incidence of hospitalizations. Kids usually have mild illness and improve very fast. Incidence of MIS-C, which is the multi-inflammatory syndrome, is less than 1:1,000. The reason of children being less affected by COVID-19 is children generally do not have comorbidities like high BP, diabetes, heart disease, lung disease, cancer, etc. The ACE receptors, which provide the binding sites to the entry of the virus, are poorly developed in children, so making them less vulnerable. Herd immunity, another factor which will determine the aggressiveness and impact of the third wave. Herd immunity occurs when 75% population are immunized. Immunity comes via infection or vaccination. In a population of 135 crore, herd immunity is achieved at around 100 crores. For one individual testing positive, actually there are 10 positive patients, as many contacts and family members do not get tested and go undetected. More than 3 crore people have tested positive till date. Practically, 3 into 10 is equal to 30 crore or more people have had COVID-19 so far. Total vaccinated, 30 crore. Total immune, 60 crore. To achieve herd immunity, we need 40 crore more people to be vaccinated with both doses of the vaccine. A Herculean task indeed, but has to be done. Together, we need to win this war. Preventing the third wave. This is imperative for India. As the age-old saying goes, prevention is better than cure. And the levels at which we can prevent the third wave are the individual, family and friends level, community level, the state and the central government's level. Dear friends, it's not just the government, but you who will play an important role in preventing the third wave. Now I'm coming to prevention of individual, family and friends. Masks are the single most important way of prevention of future waves, apart from vaccination, and I'm going to talk a lot about it. Wear your mask properly so that it comes all the way down . Again, it's come like this. Something is wrong. Wear your mask properly so it comes all the way up, close to the bridge of the nose. And keep it snug on your face. It should also come all the way down under your chin. Now, which mask is best? There is a wide variety of masks which are available in the market. The N95 mask, which is comfortable, is the best. Now, other masks are transparent masks, which can be worn over your N95 mask for added protection. Virucidal, bactericidal, and fungicidal masks are treated masks. Latest is the mask called LG Puricare with a built-in air purifier. You must not hesitate to suggest people around you to wear these masks if they are not wearing. Be bold and protect yourself and each other. Double masking is important according to guidelines in India. Cloth mask on top of a surgical mask provides extra protection and protects you by 95%. If N95 mask is used, you may wear just one mask. The dangerous mistakes of wearing the mask incorrectly are: never remove your mask to talk to anyone. Don't share masks with anyone. Never pull the mask down to eat or drink. I'm also going to show you the visuals. Here, please don't wear your mask like this. It's a big no. Never expose your mouth and nose. Do not allow others to touch your mask. Never pull the mask down to eat or drink. Never commit these 3 mistakes, like talking to colleagues, friends, or relatives with your mask off. Never wear a valved mask, because the problem with valved is that it protects the person wearing it, but not the people around. Never share your mask with friends and family, or keep your mask in pockets or handbags. Do not wash your surgical or N95 masks. Handling of masks. Carefully untie the strings behind your head or stretch the air loops. Handle only by the ear loops or ties. Fold the outside corners together. Be careful not to touch your eyes, nose, and mouth when removing, and wash hands immediately after removing. Save yourself and save society. The proper disposal of surgical masks. So surgical masks should be disposed of in a closed dustbin. Cloth masks should be cleaned with soap and water. My N95 mask, I use the UV Pure handheld sterilizer to sanitize my masks. I also use it to sanitize my personal items like mobile phones, keys, spectacles, cash, etc., electronics, groceries, toys and sports equipment, courier, packaging, documents, furniture, pet areas, bathrooms, cars, elevator cabins can all be germ-free by the UV Pure. Any object entering your home or workplace, if sanitized by this UV Pure handheld sanitizer, will prevent surface spread of any germs, including COVID-19. It just takes 10 seconds to sterilize an object. This UV light does not harm food or any object, just makes it COVID or germ-free. This is being used in hospitals, clinics, ambulances, offices, etc., and is available on Amazon, Flipkart, etc. Other measures of prevention are Avoid fights, arguments, public areas like malls, and also public transport, except for work. Reduce hospital visits for simple issues. Take online consultations instead. Avoid marriages, similar functions, prayers, meetings, etc. If you do attend, don't remove your mask at the function and don't eat and drink. Watching marriages, prayer meetings, etc. on online platforms is the new normal. If you do travel, isolate yourself for 5 days to protect your relatives. Always carry an extra mask and hand sanitizer with you when you go out. At home, keep washing your hands frequently. At your office and workplace, follow COVID appropriate protocol. Do not touch your mouth, eyes, or nose with your dirty hands. Wearing gloves or sanitizers when you're out shopping helps reduce infection. Try to opt for online shopping. Avoid using public toilets as toilets are COVID bombs. 6 feet ki duri, mask hai zaruri is an important slogan. Although we all know that the virus can infect up to 20 feet or more in the form of aerosols, but I still feel that distancing helps a lot. Video calling is a better way of keeping in touch with people. Coming to another step of prevention and a very, very important step. This is increasing your immunity. A healthy, balanced diet is very important. Energy-rich foods like cereals, especially whole grains, are very good. Bodybuilding foods like proteins, which are present in dals, beans, legumes, eggs, milk, meat, fish, etc., are to be preferred. Protective foods are foods rich in vitamins and minerals. Eat a rainbow every day is what I tell my patients. Now, immunity boosters like herbal tea or kadha made from tulsi, cinnamon, black pepper, ginger, monaca, raisins taken once or twice daily benefits your health. You can add to it jaggery, honey, and lemon juice for taste. Taking neem leaves is also good. Golden milk is a half teaspoon of haldi with a pinch of black pepper in a cup of hot milk. Drink warm water to stay hydrated. Take 2 liters of water per day. The healthy tips are don't skip your meals. Keep on changing your cooking oil every month. Desi ghee, if taken in less amount, is also good. Almonds, walnuts, flax seeds, chia seeds are antioxidants to be included in your daily diet. You may not like what I'm saying just now, but restrict alcohol, tobacco, and smoking. Change to a healthy lifestyle. Sleep for 6 to 8 hours and minimum or no late nights. Keep yourself busy by doing some online courses or interaction with relatives via video calls. So remaining at home doesn't mean that you're isolated. Be active, keep yourself busy and fit, meditate, enjoy music, do something you like, read, water plants, watch TV, and above all, do yoga and breathing exercises. Breathing exercises are simply think of smelling a flower, then blow out your breath as if you are blowing the pinwheel of birthday candles. Blow from the balloon, and the next we come to yoga. Regular practice of yoga with a minimum 20 minutes should be your activity number 1. Breathing exercises, pranayam, kapal bharti, simha kriya, surya namaskar, etc. must be practiced to increase immunity and keep fit. Simple stretching exercises are good. Other breathing exercises are spirometer exercise, diaphragmatic breathing, pursed lip breathing. Practice these exercises 5 to 10 minutes, about 3 to 4 times a day. Other lifestyle changes are exposure to sun for 15 minutes early mornings gives us vitamin D. Walk for 15 minutes, 1 hour after each meal. Respiratory hygiene is very important. Make sure that when people around you cough or sneeze, they cover their nose and mouth with their elbow. You are a savior if you hosted a virtual party instead of a real one, didn't go out for party with friends, stayed home and followed social distancing, and worked from home. The most important preventive measure is vaccination. Register on COVID app and get yourself vaccinated. Covishield, Covaxin or Sputnik, whatever is easily available, just go for it. Any COVID vaccine is good, as WHO has rightly said, that the best vaccine is the one which is on your arm. Please do not hesitate to get your staff vaccinated as well. The best way to curb future waves is if the entire population, including the children, are vaccinated. Pfizer is now being used for vaccinating children 12 years and above, along with adults. Unfortunately, we do not yet have Pfizer and Moderna vaccines yet in India, but talks for Pfizer coming to India have reached the final stage. Pfizer has started trials to vaccinate children of 6 months to 11 years, and so has Moderna of Bharat Biotech. And so has Moderna. I wanted to say that India too, Covaxin of Bharat Biotech is going to come soon to vaccinate 2 years old children and above, and will be expected by September this year. India to start trials on safety efficacy of mixing vaccination doses. If this is approved in India, then soon you will be taking the first dose of Covishield and second dose of Covaxin, or vice versa. People who have taken the first dose of Covaxin or Covishield could be taking the second dose of Pfizer, Moderna, or Sputnik. Maybe this cocktail could give us better immunity, but this is still to be established. Coming to prevention at the community level. Already the various RWAs are organizing vaccination camps in association with private hospitals, and the center has also approved of this. These camps are being held at community centers, clubs, malls, etc. Drive-through COVID vaccination centers contribute to safety to public during the vaccination process. Masks and sanitizers are being distributed to household staff, gardeners, electricians, plumbers, labor at construction sites and factories. These people also need to be motivated for vaccination by the community. Coming to prevention at the government level. The government has made it mandatory to wear double masks, but this needs to be especially enforced in public areas like markets, malls, banks, offices, and heavy fines should be levied to defaulters. The government is organizing increased production of vaccines, better availability of vaccines, and increasing the number of vaccination centers which should be there in all government institutions, including schools, hospitals, and public health centers. Government is also organizing import of Pfizer and Moderna vaccines to increase the number of vaccinations available. Research is going on all over the world and even India to have oral and nasal vaccines for adults and children. And once we get these, we will be able to do mass immunization without the help of vaccinators. We also need to have aggressive research in manufacturing vaccines which can protect us against all variants of the COVID virus. This will prevent spread of disease and death to a great extent. You must have heard of the new universal COVID-19 vaccine. This may help to prevent future pandemics, according to US scientists, as it will be effective against all coronavirus. Just think, if this happens, it will be the end of this pandemic for sure. Now, if COVID cases begin to show a rise, timely closure of all public areas should be done, and timely lockdown of containment zones is a must to curb the spread of the disease. Government is also doing a lot at the rural India level. At rural areas, primary health center staff, school teachers, volunteers need to educate villagers about respiratory hygiene, masks, sanitizers, distancing, and vaccination. For this, online training of primary health center staff, school teachers, and volunteers needs to be done. I'm again repeating the age-old saying, prevention is better than cure. Coming to the actual preparedness for the third wave, at the individual, family, and friends level, you all need to create a COVID emergency kit with essential medicines, paracetamol, betadine mouthwash for gargles, a vessel for steam inhalation, vitamin C, vitamin D3, and vitamin B complex are important in your kit. Keep a thermometer, pulse oximeter, spirometer. And those of you who have senior citizens in their house must also keep an oxygen cylinder. Make sure you download and update Arogya Setu app regularly, wear your masks properly, maintain COVID appropriate protocols, step out only if necessary. At the community level, every community should have one or more COVID care centers to which the residents should be able to rush to for any emergency or just for a consult when they get symptoms of COVID. The COVID care center should have nurses, doctors, paramedical, and support staff. There should be provision for oxygen, oral and IV, routine and emergency medicines used for COVID patients. There should be special provision for pediatric oxygen and IV cannulas. That is for the children. At the level of the government is already ramping up ICU beds and facilities for children and adults, increasing COVID beds in hospitals and COVID care centers, improving infrastructure in ICUs and pediatric and neonatal ICUs as well, procuring oxygen and oxygen-related equipment for adults and children, including ventilators and oxygen concentrators, procuring COVID-specific medicines, oral and intravenous for adults and children, and making them readily available. Training of health personnel according to COVID treatment guidelines and also for pediatric interventions. Installing oxygen generators not only in hospitals but also in public health centers and other institutions. Making monoclonal antibodies readily available so that they can be injected to high-risk patients as soon as they test positive to reduce the severity of COVID. Where is everybody rushing to after the unlock? towards the third wave, I guess, due to irresponsible and rash behavior. The graph clearly shows the IIT Kanpur predictions of the third wave. Be alert and ready. Remember, their second wave predictions are all 100% true. This is a very positive slide, and it's my favorite because it's a very hopeful slide. We will be safe once we acquire herd immunity. I conclude by saying no one is safe until everyone is safe. Thank you.
We are now open to questions. If anybody has any question, you may unmute and speak.
Hello, Dr. Monica. Thank
Hello.
you very much for this wonderful talk. So actually just wanted to know that you said once we all acquired herd immunity, we will be safe. Now, are we in the process of acquiring herd immunity, given that the statistics and the data are always not very reliable?
Well, I'm sure that we are in the process of herd immunity because of ramping up of the vaccinations, and especially in the second wave, there were so many people who were infected. As I told you in my herd immunity slide, that there were about 30 crore people infected so far. So that means with 30 crore vaccinations, 60 crore are already immune. So even if we feel that the data is maybe a little inaccurate, so we can come up to say that instead of 60 crore, we would say about 50 are immune. So that makes it 50% of us. And at the rate the vaccinations are being conducted, I'm very, very hopeful.
Okay, thank you very much. Thanks for that clarification.
Dr.
And
Monica,
for that hope.
can I come in, Dr. Monica?
Yeah, sure.
Hi, Dr. Monica. It was really a very wonderful talk. It was very simplified and so with the correct figures and all. I really appreciate it. My query is, all the COVID centers we had opened, we had hired doctors, nurses, and now since again the number of patients has gone down, they are all thinking turning the beds again into non-COVID. So how do you predict the third wave? How sure one is, and on what basis do we predict the third wave? The timing and the severity and the age group which will be affected and all, any idea?
I have covered this all in my talk actually,
I
but
know.
I will surely repeat this again to an extent. See, we already covered that as far as the age groups are concerned, it's going to be the same as it was in the first and second waves. Of course, since the children are not immunized yet, they would be affected, but generally, the children have a very mild infection. As I already said, that they have literally, generally speaking, children don't have comorbidities of adults. And also they do not have, the ACE receptors are not developed that well. So children are less prone to severe infection. And as far as this is concerned, that when it's expected, the experts at AIMS were saying that it is expected by mid-July. Actually, all we have to do is be very, very alert And as soon as the cases start rising, there should be immediate action on the part of us individuals, like I said, on the individual level, on the community level, as well as on the level of the government. We all have to be alert.
Yeah. Okay. Okay. Thank you so much. That answers my query. Thank you.
Okay. Anybody else? I have actually covered quite a bit. So if you still have some questions, please let me know.
There's one thing that we have here. When should we get the second vaccine? Like it was told for 1 month and then 2 months, and then the number kept changing. So when the second dose is going to be like available?
Yeah, so this is a very, very important question, and I'm glad somebody asks. If you've got the Covishield vaccine, you have to get it after 84 days. If you have the Covaxin, you have to get it after 4 weeks. Also, I would like to say that lactating mothers should go in for the vaccine. There is no harm. All people with comorbidities should rush for the vaccine. And only right now trials are being carried out, and the South Delhi Gynae Forum and the FOGC, we are all asking the government for getting the pregnant mothers also vaccinated. Another thing I would like to tell you that if you have somebody took the first vaccine and he got COVID after some time, then the second vaccine, according to the government, should be taken only after 12 weeks of recovery. So that is the government protocol. But before this was set up, I used to tell my patients to get it done after 8 weeks of recovery.
Okay,
Yeah.
thank you so much. We'll wait for a few more minutes if anybody has any questions. After that, we'll wrap it up.
Okay.
Dr. Monica, what about the Delta Plus? There are 20 cases have been reported in India
Yes.
from, say, Maharashtra, Kerala, and other things. So,
Yeah.
do you think it is a big threat to our country?
Hello, good afternoon, Dr. Archana. I would, this is what I had mentioned in my talk while I was talking about the alpha, beta, gamma, delta variants, which are the variants of concern. I also said that this delta plus variant is a variant of concern for India because this is the one which could be responsible for the third wave. And unfortunately, all the states of India are interconnected and people can spread this infection, from one to the other. So containment of this strain is really, really important.
But now, since it has started, you know that what why this thing is concern is that the same thing happened with the Delta virus when it started in January in Bombay, and we never took any seriousness about it in Delhi. So we had to suffer in Delhi during the months of March and April. So that was it. Again, the same thing is happening.
Yes. I totally agree with you, Dr. Archana. This is, it depends. I think this time the government will surely, take care as far as flights are concerned, as far as containing the particular areas where the Delta virus is. And also this Delta plus strain, the Delta plus strain is there. So those areas should be contained, and also the lockdown, if the cases start rising or the Delta plus variant reaches here, the lockdown will have to be much quicker. Yes.
Okay, thanks.
That's all we can do. We have to prepare for the ICUs and the COVID beds and all that we are doing. But at the community level, our RWAs have, started COVID care centers, and we have also taken an active part in that. Starting of COVID care centers in all communities, which have all the facilities of oxygen and everything. And let's just step up the vaccination and hope, because there is also a concern that this Delta Plus variant may affect those who are vaccinated also, as the Delta variant also did. Yes.
And as you are saying community level, do you think you can, it is on the larger scale, because in the community, how many beds you can provide with the oxygen? That is another thing.
Yes, that's right. But, like previously during the second wave, the beds were not available. So hospital beds were not available. So at the community center, the patient can at least be properly, looked into before he is shifted to the hospital once the bed is found. At least he is not at home and everybody is getting frantic how to manage the case. And that is what the community care centers are there for, COVID care centers.
You are right in a way, but if the same thing happens at that,
you are
that
absolutely you are absolutely right, Dr. Archana. I would be really, really happy if any of us can give us, a better option or some measure, any idea which can give us relief from this would be welcome.
Okay, thank you so much.
Dr. Monica, I had a question. The question was regarding these UV light filters. How effective are they to reduce the impact of, the virus?
Well,
especially when you go out and you come back home, are they effective?
Yes, they have been tested in the laboratory. The one I have has been laboratory tested. And it has been found to be 99.9 something like that effective against COVID virus and other viruses.
Thanks, doctor. That means that we should really all, I got to know about this very late, but I think we should all have one at home.
In for this. Because in my place, anything entering a house, like yesterday only, one of the residents sent me some document for signing for the driving license. And I took the document, it was UV pured, and then I signed on the document. So it was quick and simple. My N95 masks, I don't need to hang them out in the sun for 2-3 days and then bring them out. I just UV pure them and that's it.
So that's fantastic, doctor. So that means that this is as important as a mask, as a first line of defense.
Yeah, it's a very, very important thing. But yes, people are realizing it. It is being used in ambulances also. It's very good. See, in the diagnostic center, if somebody is doing these CT scans of COVID patients, and then you have to do a scan of somebody else who is a non-COVID. So sanitization of that area is very important. So how will that sanitization be done? That should be done by the UV Pure sanitizer quickly. It hardly takes any time.
Right, doctor. Thank you. Thank you so much. That's very, very, very helpful.
Thank you so much.
Ma'am, we'll wait on for 2 more minutes and we'll wrap it up then.
Okay, sure.
Can I ask another question?
Some guest has a question. Yes.
Sure.
Yeah. So the question was, Doctor, about the difference between mRNA vaccines and viral vector vaccines. While there is, of course, is probably is a difficult question to answer because the research is still ongoing, but theoretically, it probably would be possible in the future to follow up. I mean, like a vaccine cocktail. The topic is really about a vaccine cocktail to follow up a mRNA with a viral vector or vice versa.
So I just spoke about this in my talk. I spoke about this that the government has already started trials of for checking out of mixing the vaccinations. So just as in some countries, they are doing this, giving Covishield, and after that, the second dose is Pfizer or Moderna. I have covered this in my talk by saying that once the government, is able to, have some result on these trials, very soon, it will be possible for, us Indians also to have one of first dose of Covaxin and second of Covishield or vice versa. Or if we had any of these Covaxin or Covishield doses, the second dose could be of Pfizer, Moderna, or even Sputnik. So these doses could also, the cocktail could, maybe the immunity would be better with them. We do not know yet. It has not been established so far.
Right, doctor. So, any case, hopefully, forthcoming, there are promising results because they say that this could be more effective.
Yeah, once the trials happen, then yes, it could be much more effective. Yes.
Right. Thank you.
Dr. Monica, Covaxin is not for the travel. It is not accepted for the travel. So if there is a cocktail, say Covaxin and Covishield, so what is your opinion? Then they will allow, because Covaxin is not considered, for the travel abroad.
Yes, you're very right. Like talks are being carried out. This is kind of more at the national level as well as an international level question. So yes, but what I feel is that people with comorbidities should go in for Covaxin and for the time being, forget the travel part. And I've heard that even the United States, as well as other countries who have not given permission for people with Covaxin, they are considering this. So let's hope in a few months this gets rectified.
Okay, thanks.
Yeah, and doctor, I have a question. Can you listen to me?
Sure.
Like my son, being the 30 years, he was about to be vaccinated, but then he got infected, like COVID. And so for the first vaccination also, can he go after 12 weeks?
For the first vaccination,
After
see,
COVID, after recovery
according
of the
to
COVID.
government guidelines, it is 12 weeks. But
Okay.
there are people who are getting it done after 8 weeks. Why
Okay,
don't
so
you
there
get
is,
his IgG antibodies to SARS-CoV-2 and see if he's got enough antibodies, then you are not worried. Also,
right.
by now we know that anybody who has been infected with COVID virus, there is the immunity in the bone marrow, which is the T cell immunity, which could be lifelong. So do not worry so much. Get the COVID antibodies done, and if they are there, then it's all fine. Between 8 to 12 weeks of recovery, you can get them vaccinated.
Thank you so much.
Okay.
Does anybody have any other question?
I think it's all good.
Yeah, so we can wrap it up now. I, on behalf of payU, thank you for joining us today and delivering such an insightful session. Thank you to the audience for being a part of the session, and we'll be connecting soon again in the upcoming events. So
Thank you
you
for
so
being
much.
there. Thank you.
Thank you. Thank you very much.
Thank you so much. It was really very innovative. Thank you.
Thank you.
Bye, Monica.
Thank
Nice
you,
hearing you.
Dr. Kiran. Thank you, Dr. Kiran Kukreja. Honored that you are there. Thank you so much.
I'm
Thank
in
you
the
so
metro,
much.
but I attended the whole session almost.
Oh, I'm so
Monica. Monica, it was really nice. Thank you.
Thank you very much. Thank you for being there. Thank you.
Thank
a lot.
you. Bye bye. Thank
Yeah,
you.
bye-bye. Bye.
Bye.
Yeah.